Uganda is bedeviled by a number of serious and deep-rooted social problems that affect the well-being of the whole country. And one such problem is maternal mortality.
Men and women still look at hospitals as being unfriendly.
We are still losing very many mothers, especially in delivery and post-delivery.
For the last 13 years, the Nnabagereka Development Foundation has been helping youth, children and women to improve their livelihoods. This we have done through education, health and economic empowerment. And one of our objectives of being here today is to try and mobilize funds that will help mothers in this country to realize better health services wherever they visit health facilities in the districts of Buikwe and Mityana. And because of this, I appeal to you to help us fundraise for this objective, because it's a noble cause that will help us realize a better future for us and the generation that will come.
The health of a mother impacts the family and even the entire community. Her ability and access to receive necessary health care largely determines health outcomes for herself and her baby. Like many developing countries, Uganda has high maternal mortality rates. The Uganda Demographic Health Survey 2011 estimates that 438 mothers die for every 100,000 live births, which is reflective of limited access to health care and other social services.
Millennium Development Goal on maternal health is the one which Uganda is not likely to achieve. That is reducing the maternal mortality or the death of mothers during birth by 3/4 by 2015. We are getting to 2015, but we are still seeing many mothers dying. And on average, 16 women die every day in Uganda during childbirth or while they're pregnant.
Most of these deaths are caused by the distances that the women must move to the nearest health facility for antenatal.
Even where health care services are available, they are often understaffed and low on supplies, which can also have an effect.
So you find that in all the hospitals, whether you go to Mityana Hospital, whether you go to Mwera Health Center for Ochantungo, those are the three facilities that are supposed to provide emergency comprehensive obstetric care. You find that at any one time, either there is no doctor on duty at that time, or there are no drugs, or the few health workers who are there are overworked.
Traditionally, Ugandan women seek to handle birth on their own, as it is a time when they can use their own power and make their own decisions, which can also be a factor in such high maternal mortality rate.
So instead of going to a health facility where you'll find many mothers unattended to because of having few midwives, you would rather stay with a traditional birth attendant who can attend to you with the passion that you require as a mother who is expecting a baby and in labor.
When you interface with women and you ask them why they prefer traditional birth attendants, they tell you not a traditional birth attendant, even if we are poor, you can just go with a few things and the traditional birth attendant will welcome you, will provide you with some hot tea, whereas the midwife will not do it. Then the traditional birth attendant will massage your back. But the trained midwife in the hospital does not massage my back. There is even the issue of the birthing position. The traditional birth attendants allow women to give birth while squatting. In the health centers, the modern midwife ask the women to deliver while looking up and legs up, and there is no privacy. So really, the community look at these issues and many think the environment is more friendly. Of course, they don't look at the issue of complications, but because the fact is that a traditional birth attendant cannot manage a complication. And actually, most of the women who die in our hospitals die because they spend a lot of time with traditional birth attendants. And by the time they come to the hospitals and health centers, they're either half dead or the uterus is already ruptured, they've already bled, and they come to just for during the last minutes of their life. And of course, the population is not aware of this.
Many women report mistreatment from healthcare personnel as an additional reason to avoid seeking professional care during pregnancy and labor. Majority of Ugandan women lack health literacy and in turn seek care in more traditional or homeopathic ways. Many people in Buganda still lack adequate health care and programs that give information and means about safe motherhood, protection of girls and women against unwanted pregnancies and sexually transmitted infections.
Okay, most of our communities still lack adequate reproductive health care and programs to give information and means of protecting women and girls. For example, protecting girls against unwanted and early pregnancies, which in most cases end up in death, and protecting women from losing their lives during delivery or the lives of their newborn. Needless to say, the healthcare programs and information provided can also meet resistance because of deeply held social and cultural beliefs about sex, parenting, delivering, and the roles of women and men.
People still have a lot of myths and misconceptions against family planning. People still have a liking, a tendency to have large family sizes. So you find a woman having children year in and year out, and the teenage pregnancy rate is also high. So you find so many girls getting pregnant early, at the age of 15, 16, and then they have these children nearly every year.
The community counseling about the cause and effect and side effects of family planning methods is very, very important. The misconception of them must be allayed so that mothers can undertake family planning methods. Especially, they need support from the male counterparts.
Diseases like malaria are substantial issues. Pregnant women and their unborn babies are particularly susceptible to complications related to malaria, which is endemic in Uganda, an issue that needs to be addressed in order to improve maternal mortality in Uganda. Ever since she became the Nnabagereka of Buganda, Lady Sylvia Najinda Luswata, through the Nnabagereka Development Foundation, has endeavored to improve the maternal and child health throughout Buganda and Uganda as a whole. During her campaigns, the Nnabagereka, who is also the Millennium Development Goal 3 Goodwill Ambassador, interacted with various stakeholders at grassroots level, including cultural and religious leaders, political leaders, and public servants.
I have been carrying out advocacy at the grassroots level through strategic visits, meetings, workshops and rallies, advocating for improved health through the promotion of sexual reproductive health, safe motherhood, family planning, and gender rights. I have been addressing leaders in all the various sectors: religious, culture, health, educational, women groups and youth groups, as well as communicating directly with the men and women and youth groups in rural areas. We have worked with UNFPA for over 10 years and also collaborated with the Ministry of Health, as well as worked with other UN bodies such as UNAIDS, WHO, UNICEF, and both international and national NGOs, as well as many local community initiatives.
This prompted Her Royal Highness, through the Nnabagereka Development Foundation, to embark on a pilot campaign focusing on the districts of Buyikwe in Chagwe County and Mityana in Singo County.
The maternal health indicators for Uganda have remained generally poor over the last 2 decades. To meet the MDG targets, Uganda will have to reduce its mortality rate from 438, where it is right now, to 131 deaths per 100,000 live births by 2015. So we appeal to the government, NGOs, and other players to commit more resources towards the fight against maternal mortality. On my part, together with the Nnabagereka Development Foundation, we will continue to engage in interventions that will bring about improved quality and increased use of safe motherhood services, increased use of family planning methods, reduction in infection of HIV and sexually transmitted diseases, increased child survival, and a reduction in maternal death. Therefore, we feel that our effort towards supporting postnatal services in the districts of Buyikwe and MATERNAL is a critical step in contributing to the reduction of maternal mortality.
The campaign will involve increasing awareness about sexual reproductive health rights, gender-based violence, safe motherhood and child spacing, popularize the benefits of male participation in maternal care and reproductive health within communities, introduction of waiting homes near health facilities for expecting mothers, advocate for women economic empowerment, plus advocating for infrastructure development.
We thank our partners, individuals and organizations that we've worked with over the years and request them to uphold the relationship as we continue to serve our people.
Join Her Royal Highness the Nnabagereka's cause to ensure that no more mother or child dies in the process of giving birth in MATERNAL and Buyikwe districts.